So you don't have to know their entire origins. The origin, where they come off of the brain, there's only 3 or 4 of the nerves that are consistent enough and large enough that we can see them on our sheep brains. And I would just say those are number 1, which is the olfactory, which comes from the nose, obviously. Number 2, which is the optic and comes from the eyes. And the optic nerves are pretty big because they carry a hell of a lot of information. And the last one is probably the trigeminal, because it's big. It's the largest of the other cranial nerves. When you look at your brains and you look at that human brain that's over in the lab in a bucket, you'll see a bunch of little tiny nerves coming out of different parts of the brain, and that's the cranial nerves. But you can't, they're so hard to tell apart, and I don't think you need to. Just know those big 3 that I put stars by. Be able to identify them on your models and on the on your sheep brains. As far as their destination is concerned, a few of them you'll figure out where they're going to. I do not require you to memorize exactly which hole in the skull they come out of. Now you remember, and you've subsequently forgot, all those holes in the brain. Remember those foramens and all that stuff? Boy, you got a good idea of them, but I'm not going to ask you which one everyone comes out. This is kind of what the bottom of the brain looks like. So here's the spinal cord coming out the bottom. Here's the olfactory nerves. These are your smelling nerves, basically, and they are very obvious. You won't have any troubles identifying cranial nerve number 1. You also won't have any trouble identifying cranial nerve number 2. The cranial nerves come this way from the eyes. They meet at this thing called the optic chiasm, which is very characteristic. And so that'll help you identify that one. And then the only other nerve that you might even try to identify is this one here, the trigeminal. Doesn't show up quite as well as it could on this picture, but it's by far the biggest of the rest of the nerves. Okay? Notice that the optic nerves come right here near the infundibulum that goes to the pituitary gland. Yes?
The trigeminal on the mesencephalon?
Yes.
Okay.
I believe that's correct. Yes. Looks like it kind of comes out the side of the pons. Okay, so let's go through them one by one. I really believe if you just pay careful attention, you'll have most of this down by the time we get to the end of it. The olfactory nerves are purely sensory. See, they have an S up there above them, and all they do is carry smell. They start at the olfactory epithelium, which lines the inner part of your upper nose above the upper concha, and then then the little fibers from those nerves go through the ethmoid plate, or the cribiform plate, we called it. Remember that thing has a whole bunch of little tiny holes way up front there, and from there it goes to these olfactory bulbs that I just showed you. These are the olfactory bulbs right here, and so that's where they make their first synapse and then go on back to the olfactory area. Now, a pearl here about the olfactory nerves is smell is the only sensation that we get that does not stop in the thalamus. It does not go through the bypass station of the thalamus. It goes straight from the nose through that nerve directly into the cerebrum. Okay? Now think about that for just a second, and it might make a little more sense, because have you ever smelled something that smelled so bad it just made you sick and made you vomit and made you just yuck? Well, our smell sensations go straight to our brain and have a very intense effect sometimes, and that's probably where that comes from. It does not get weeded out at all by the thalamus. Okay, so that's number one. Remember the old Crista galli, that little piece of bone that sticks up there? And then from there they go straight to the cerebrum. They do not pass go, they do not stop the thalamus. Yeah?
You say that was the only sensory nerve that doesn't go through the thalamus, or is it the only?
The only nerve that doesn't go through the thalamus, yeah. So here's a little close-ups of it. Here's the olfactory epithelium, which is in the very upper part of your nose. These little olfactory nerve cells pick up the smells here due to a chemical reaction with the odoriferous chemicals. Send the message up here to the olfactory bulb, and from here they go straight to the olfactory cortex. Number two, the optic nerves. The optic nerves are also purely sensory, as you see over there, and they only carry one thing, and that's your vision. Okay, they carry nothing but the image that you're looking at. Those sensory cells are located in the retina of your eye. We'll learn about that in a couple of chapters. They go through the optic canals out of the back of the eye socket, and they're headed to the diencephalon via the optic chiasm. We'll talk about that optic chiasm in a minute. I showed you where the fibers from both sides come together and mix, and some cross and some don't cross. I'll explain that to you more carefully when we get there. Anyway, they go to the first place they go to is the lateral geniculate nuclei. I believe that's a nucleus that's located in the thalamus, and they go from there. So here they are. Here's the optic nerves right here. This is the optic nerve. It comes back to the optic chiasm where things cross. Some things cross and some things don't. And from there, those fibers go to the lateral geniculate nucleus in the thalamus, as I said. And then from there, they radiate on back to the visual cortex, which I said earlier is in the occiput, in the occipital region of your brain. And just real quick, because this is a pretty good diagram, you notice that it's different. The fibers that are on the lateral side of your retina here, these fibers here, do not cross over. They come back here and go straight back. Okay, same on the other side. Ones from this side cross over and then go back. On the medial side of your retina here, they do cross over and go to the other side. And same over here. On the medial surface of the retina, they do cross over and go over here. Well, why would it work that way? Think about this for a second. Because the lateral side of your retina over here sees out that way. Okay? So it sees the medial visual field. The lateral retina sees the medial visual field. The same over here. This side, which is now called the medial surface of this retina, sees out there as well. So the reason they cross over like that is so that this side over here only sees that way, and this side over here only sees that way. So it's basically putting your two visual fields together to allow you to process that and make it work. Okay? We'll come back to it, of course. I don't know if you guys can see it up here, but if I look here at this screen, I see that this image is actually made up of a whole bunch of dots, right? And if you look really close, you'll notice that those dots, even out here in this white area, are red and green and blue, I guess. Anyway, RGB, right? Red, green, blue, yeah. So, and then the black ones here just have more of the blue and more of the red and so forth. And it's a matter of processing all these little dots of light that allows us to make a picture out of it. That's the same way our eyes work. except we have retinas that have a whole lot more dots than this. You know, the Apple designers were pretty smart when they created this new incredibly clear screen, and they called it the Retina screen, didn't they? Retina something. Well, that's what they're trying to get as many dots on here as we have in our eye. They'll never do it. They'll just never do it because our eye is so incredible. But I hope that gives you some appreciation for your eyes. They're pretty cool things. Number 3, oculomotor nerves. Let's see. Oculomotor nerves are purely motor, right? And sure enough, our eyes have 6 muscles that make them move. To the right, to the left, look up, look down, and then 2 that kind of twist it a little bit to keep everything looking right. And the oculomotor controls 4 out of those 6 muscles. The 2 that it doesn't control are the trochlear, which goes to superior oblique, and the abducens, which goes to the lateral rectus. We'll go over these in a minute. So the other 4 are all here. 1, 2, 3, 4. And then they throw in this extra one, which really isn't a motion. It doesn't move the eye, but it moves the eyelid. Okay, so the levator palpebrae superioris muscle, what do you figure it does? What's the palpebrae mean? Palpebral fissure. Palpebrae refers to your eyelid, okay? Eyelid. So the levator palpebrae superioris is the one that lifts your superior eyelid up. It elevates it, it levates it, levator. Palpebrae, the lid, and it's the superioris, as opposed to the one that might lift your lower lid. There is none, by the way. Okay. The other thing that it carries is some little fibers that go to the intrinsic eye muscles. Now, what's it mean? What's an intrinsic muscle mean? Intrinsic, extrinsic. Y'all might want to learn that. Intrinsic means muscles that are within an organ, okay? Extrinsic means those that are on the outside of the organ. For example, we have extrinsic eye muscles that are on the outside of the eyeball, and they make the eyeball move. And we have 2 muscles that are on the inside of the eye, inside of the eyeball, which make muscles inside your eyeball move. One set of those is the pupillary muscles that make your pupils get bigger and smaller. Okay, those are built completely down inside the eyeball itself. And the other ones are the muscles that control the thickness of the lens. So they can either squeeze the lens and make it get thicker, which changes its refraction, okay, or vision. And they can thin the lens out so we can see things from a long distance away. Okay, so it focuses the eye. So the 2 intrinsic muscles of the eyeball are the pupillary muscles that make the pupil bigger or smaller, and the muscles that change the shape of the lens. So, oculomotor 3 controls 4 of the 6 eye movement muscles, and it controls the intrinsic muscles of the iris. That's the pupil, basically, and the lens, the shape of the lens. Trochlear nerve 4 only goes to one muscle. It's called the superior oblique, and the reason it gets that name trochlea is because this is the only eye muscle that actually goes through a little pulley. Trochlea means pulley. And so if this is the eyeball here, and this is the lateral side, and this is the medial side, the superior oblique muscle runs off the top surface of the eye and goes up here and runs through this little pulley and then goes back into the eye socket. So it tends to rotate the eye this way when it contracts, but it goes through this pulley here, this trochlea, and that's how the muscle gets its name, trochlear muscle, and how the nerve number 4 gets its muscle. And then skipping on to number 6 for just a second. Number 6 is the abducens. It's the abductor, abductor, right? Abductor moving wide. It goes to the lateral rectus muscle, which is attached over here to the lateral side of the muscle. When it pulls, the eye looks out. I'll show you some examples of some folks that had little strokes that paralyzed some of these nerves, and you can see the deficit these people have. Now, this is a really complicated picture. I don't really want it to be, but let me just tell you, let me give a little speech here about the eye muscles. We're going to do the chapter on the eye in about 3 more chapters. Okay, we do a chapter on special senses, and we're going to learn all about the eye. Now, you could have learned it back when you were doing muscles. When you were in 231, you could have learned the 6 different eye muscles. How many of you did? Okay. You're getting a second chance right now to learn them, to learn the 6 muscles and what they do here as we go through the cranial nerves. You're going to have a third chance to learn them in 2 weeks or so when we do the eye. Now, if I was you, I would learn them now, because you'll get the questions right now, and you'll get the questions right when we get to the eye, which is actually going to be on the second test. Okay? So you kind of got to know them. We have really wonderful models of the eye over there in the lab, and once you get it down, they're really very simple. Just running through them real quickly here. There's 4 of them that are really easy to name because they're just named rectus. Rectum means, rectus means straight, okay? They are straight muscles. This one here is the lateral rectus. See, they've got it cut back here, but basically it pulls the eye lateral. There is the superior rectus, which is the straight muscle that pulls the lid, pulls the eyeball back and makes it look up. There is the inferior rectus down here on the bottom that makes the eye look down. And there is the medial rectus over here on the other side that makes you look in, makes you look inward. Okay? So that's 4 of them. Those are easy, right? And then the other 2 are kind of funky, but not that much. Their job is to rotate the eye one way or the other. First one here is the superior oblique that I just drew up here for you. It goes from the surface of the eye, it goes up as a tendon and runs through this pulley right here called the trochlea and goes back. Okay? And you can see when that muscle contracts, it would make the eye rotate that direction. The inferior oblique is down here on the bottom. It doesn't have a trochlea or anything. It just makes the eye rotate that way, though. Okay? So 4 of them get their nerve supply from the oculomotor. The other 2 that don't are the trochlear nerve, which goes to the superior oblique. Remember, that's the only muscle it goes to. And the number 6, the abducens nerve right here, which only goes to this one muscle, the lateral rectus, that brings the eye out and makes the eye abduct. Thus the name abducens. Okay, going back to 5, which we skipped over a little bit. 5 is the trigeminal. I've said that it's a big one. It's mixed. It's sensory and motor to the face. But let me just tell you that I always thought of this as mainly just a sensory nerve. It brings sensation from your entire face. Okay? Skin of the forehead, upper eyelid, eyebrow, part of the nose, nasal cavity. It has 3 branches. One is called the ophthalmic branch. It goes to the upper part of your face. The second one is called the maxillary branch, and the third one is the mandibular branch. And it doesn't really list them very nicely here, but let me just show you. I've got great pictures here in a sec. So it's called trigeminal because the main nerve splits into 3 parts. It also goes to the muscles of mastication. What do you think that means? Muscles of mastication.
Chewing.
Muscles that make you chew. Now I'm sure you remember the names of the muscles that make you chew, and they are...
Okay, I see.
What was that?
One's the masseter, right?
One's the masseter, that's good. All right, we'll get to pictures of them in a minute. I've already said that trigeminal nerve is one of the largest cranial nerves. It has the 3 major branches, has a couple of ganglions where these nerves relay. Excuse me? Pterygoid, did you say? All right, here we go. This is the sensory parts right here. And the 3 major parts are the ophthalmic branch that goes to the eye, the maxillary branch which goes to the maxilla, which is your upper jaw, right? And the lower one is the mandibular branch which goes to your jaw, your lower jaw. Now why are these important? Anybody here going into dental hygiene? Right? Several of you are. Well, here's a little story. How many of you have had the dentist? I was going to be a dentist once. Boy, am I glad I didn't do that. He says, okay, there's going to be a little prick here. That's just Dr. Sessions. And he kind of takes your jaw back like this. And he takes it and you kind of close your eyes because you know what's coming. And he takes this syringe and he puts it up in your jaw and he sticks it right back there in the back at the angle of your jaw. Well, why does he do that? Well, he does that because this is what he's shooting for right here. He's trying to numb up this nerve. And if he gets the numbing medicine in there close to this nerve, he's going to have your entire lower jaw numbed up. And that would be a good thing, assuming he's working on a lower tooth, right? And if he was looking to do your upper teeth, he would be looking to put the numbing medicine right up in this area, through your jaw, up in there, in order to catch this nerve right here, which is the maxillary branch, to get the maxilla, which is the bone of your upper jaw, right? And to get all of this area numbed up. So you may think these things aren't that important, but believe me, they are if he misses. And you don't get good numbing. So I always get the gas, but anyway.
How close to the nerve do they have to be? That's a ways up there.
Oh, they only have to be within about a half a centimeter or so. It's pretty close, but...
We have the hygienist doing it, I think, for restorative.
Do they? Cool. Okay, so that's the trigeminal nerve. Now the other part of the trigeminal nerve is that it goes to those muscles of mastication. This is only the sensory branches that I've shown you here. And I'll just leave it at that. Facial nerves, the facial nerve is number 7. It's basically the one that does the motor to your face, but it also does a little bit more in that it does some taste receptors on the anterior 2/3 of your tongue. It comes in through the internal acoustic meatus, And it also goes, the facial nerve does all these muscles of facial expression. You remember the old, what's the one that goes around your eye? Ocular, what? No, not oculomotor. What's that muscle called?
Oh,
It's round, right?
Orbicular.
Orbicularis oculi, orbicularis oris. Orbicularis oris is like the kissing muscle, and orbicularis oculi is the nerves here in the muscles here in your skin. It's what you close your eye with. You close your eye with your facial nerve, you open your eye with that one we just mentioned, the levator palpebrae superioris. Also notice that the facial nerve goes down here to the submandibular, salivary, to the salivary glands. Those are your spit glands. We'll come to them in great detail when we get to the digestive chapter here. Well, that's not till 2:33. Anyway, so it makes you salivate. Here is a more blown up picture of the facial nerve. And the facial nerve is in many ways like the fifth nerve, like the trigeminal, because it also has three branches. Here's the temporal branch, here's the zygomatic branch, and here's the mandibular branch. Okay? Good enough. Okay, the vestibulocochlear nerve is number 8. We used to call it the acoustic nerve, and that's why it has an A over there for acoustic. It has two branches. One is the vestibular branch, which goes to the semicircular canals and to the inner ear, and gives you balance and equilibrium. The cochlear branch is what allows you to hear. You guys have probably known somebody that has a cochlear implant. Anybody? I have a friend who's a teacher at this school who I knew in the Dalles for 20 years or so before he moved down here, and then I moved down here. And he had always been pretty deaf. He was very good at lip reading. You could look right at him, and he would understand you perfectly. But if you weren't, he didn't hear much. And within the last 4 or 5 years of being down here, teaching at PCC, he's gotten cochlear implants and he can hear. And I just love getting Facebook posts from him because he every time he hears something that he's never heard before in his life, he puts it on Facebook. He said, I could hear a hummingbird. I've always been able to see them, but I never knew that they actually made noise just from the fluttering of their wings. I remember, and he wrote one time about the rain and dripping off the tree branches and him hearing that for the first time. Pretty cool. So anyway, this one cranial nerve carries both of these things. It has two branches. One comes from the balance and equilibrium center. One comes from the hearing center. They carry that information straight up to the nuclei, which are in the pons and in the medulla. That you hear with and keep your balance with. Remember when I was up here trying to be dorky and stand on one leg? Okay? Well, this really contributes to that because you need to get all those messages sent from your semicircular canals in your ear, in your inner ear, to allow you to keep your balance. So that information, which is processed 1,000 times a second, is sent to your pons, which sends it to your cerebellum, which enables you to then get all the muscles coordinated just right so that you can actually stand on one leg, which I can hardly do. Okay? I think I've said this. Yeah. Here's a nice diagram of that. I know you probably don't know this anatomy yet, but you will in a couple of weeks. Here's the eardrum out here. This is your ear hole from the outside. This is your middle ear. here. This is your inner ear here. This is the cochlea. Cochlea means seashell. That's the shape of a spiral seashell. This is where we hear. The sound moves a little fluid along in here that then we can interpret that as sound. And then this is from the semicircular canals and the utricle, the organs of our sensation of whether we're spinning, which way is up, things like that. Yeah.
When our ears pop, what is happening in there?
It's this tympanic membrane shifting.
In like the airplane or the elevation change that?
Exactly. This picture is perfect for explaining this. When you go up in an aircraft, what happens is you get exposed to lower pressure, right? There's less pressure. Even though they pressurize the cabins, it's not as highly pressurized as it was at sea level. And as a result of that, if the pressure is less out here, then the eardrum shifts this way. Now, normally, when it shifts like that, that's not a big deal because normally air can get right up here through your eustachian tube, from your inner part of your throat, basically. Comes up the auditory tube and equalizes the pressure, okay? But how many of you have been on an airplane when it starts to go down and all the kids on the plane start screaming? Because that's what typically happens. The kids, their auditory tubes are so tiny that they can't, as the pressure builds here, now the drum is being pushed inward, but they can't get the air out of their auditory tube to equalize it. Okay? So that's why kids usually scream on the way down. It's also why kids get middle ear infections a lot. It's because this auditory tube doesn't drain into their throat very well. We'll come back to that in a couple of weeks. Okay, so that's the eighth nerve, the acoustic nerve or the vestibulocochlear nerve. Number 9 is the glossopharyngeal. Glosso means tongue. Pharyngeal means pharynx, back of your throat, back in here. It's a mixed sensory nerve. It's sensory to the back part of your tongue, parts of your pharynx back in there, parts of your palate, right? And your carotid arteries. Ooh, it goes to your carotid arteries, which, remember, control the blood flow into your brain. It also carries some motor nuclei from the medulla that go to some of these muscles in here. So the glossopharyngeal nerve is a mixed nerve, both, right? Number 9. And you notice that it gets sensory from the carotid body and the carotid sinus. Why would you want to have sensation from your carotid artery going to your brain?